So let's do a little recap of the anatomy. So basically the elbow joint is 3 joints. So that is the ulnohumeral joint, the radiocapitular joint, and the proximal radioulnar joint. All of them are lined within a single joint capsule. Let's understand these ligaments better. So the ulnar collateral ligament, it has 3 components. The anterior bundle, it runs from the medial epicondyle to the sublime tubercle, which is the medial margin of the coronoid process. The posterior bundle, which runs again from the medial epicondyle to the medial margin of the olecranon process, and a transverse bundle that's just bridging the gap between the two. So let's see how we see this on our MR images. Okay, so that's the medial epicondyle, and that is the medial margin of the coronoid process. So the structure that goes like this, that is your anterior bundle of the ulnar collateral ligament. The posterior bundle forms the floor of the cubital tunnel, and you can see it really well on your axial images. Get used to looking at every structure on all imaging planes. Okay, once you've gotten used to it and you're trained in doing that, then you will be able to identify all the pathologies much better. But these are just to begin with guidelines. So the anterior bundle of the UCL, best seen on your coronal images. The posterior bundle, best seen on your axial images. But as I will show you, you will see them on all 3 planes. I like to look at the sagittal again. So this is the medial epicondyle, and what is this? This is the common flexor tendon. As you go a little from medial to lateral, then this structure that is coming off from the inferior aspect and going towards the coronoid process, that is the anterior bundle of the UCL. And you see this fan-shaped one which is going towards the medial margin of the olecranon process, that is the posterior bundle, and the transverse bundle is immaterial, so we will not bother about it. Just some things that you must be careful about. So the humeral attachment or the proximal attachment of the UCL, it can have a little bit of hyperintensity because of fibrofatty slips. While here you are seeing that the distal attachment is right at the margin, right? But sometimes you may have it a little lower down, up to 3 mm is allowed, and sometimes it may not be so flush. Okay, there might be a little sliver of fluid separating the two. Okay. Particularly in the elderly, you can see that. Okay. Now let's do a recap of the collateral ligament anatomy on the lateral side. So on the lateral side, you have the radial collateral ligament complex. Okay. Now this has a radial collateral ligament proper that goes from the lateral epicondyle to the annular ligament. A lateral ulnar collateral ligament that goes from the lateral epicondyle to the supinator crest of the ulna, and the annular ligament which encircles the radial head. So we see that anatomy. So again, the coronal images are good for looking at it. So that outer structure, this one, that is the common extensor tendon. Beneath that, you're seeing from the inferior aspect, you see that structure that is going towards the annular ligament. That is since this is anterior, this is the radial collateral ligament proper. And then you see this structure. You see how it goes and cradles the radial head and then attaches to the supinator crest of the ulna. This is the lateral ulnar collateral ligament. Okay. Again on your sagittal images. So that is the radial collateral ligament proper, and that structure, as it's going behind and attaching to the supinator crest, is the lateral ulnar collateral ligament. The annular ligament is best seen on your axial images, and it has this anterior and posterior attachment onto the sigmoid notch. Remember that the posterior attachment can be a little bit more heterogeneous, again from multiple slips.